Unraveling the root, the patient's indispensable role in uncovering holistic solutions. The statistics surrounding congestive heart failure, CHF, paint a stark picture. Approximately 50% of patients face mortality within 5 years of diagnosis. While medical advancements have undoubtedly improved outcomes, the disease remains a leading cause of death worldwide. Yet, amidst the data and established protocols, individual patient experiences frequently offer profound insights that challenge conventional thinking, expose systemic limitations, and highlight the intricate interconnectedness of the human body. Critically, these personal journeys underscore an often underestimated truth: the patient's active role in self-education and continuous pursuit of solutions is not merely beneficial, but often essential to avoid mistreatment and achieve true well-being, especially when even standard diagnostic tests may fail to capture the full reality of their physiological state. The journey to holistic recovery, a case for patient-driven discovery. Meet Mr. John, not his real name, a longtime patient diligently managing his hypertension and CHF through prescribed medications. For years, he adhered to his treatment plan, trusting in the expertise of his medical team. However, a cascade of seemingly disparate symptoms began to emerge. His legs grew weak, an inguinal hernia developed, he experienced a rectal prolapse, his trips to the bathroom became frequent and urgent, his bladder became difficult to empty, and his heart would occasionally skip a beat, causing a jolt of anxiety. Frustration mounted. Mr. John felt intuitively that these weren't isolated incidents but rather manifestations of a deeper, underlying issue. Driven by this conviction, he embarked on his own journey of research, delving into the mechanisms of his medications and their potential side effects. His investigation led him to a crucial realization: the very drugs intended to manage his CHF, bumetanide, a diuretic, which helps remove excess fluid, spironolactone, another type of diuretic that helps regulate salt and water balance, and Jardiance, a medication that also has a fluid-removing effect, in addition to managing blood sugar, could all contribute to electrolyte imbalances. The science began to connect the dots for Mr. John. Diuretics like bumetanide and spironolactone work by increasing fluid excretion, which can inadvertently flush out essential electrolytes such as sodium, potassium, and magnesium. Jardiance, while primarily targeting blood sugar, also has a diuretic effect and can influence electrolyte balance. Mr. John hypothesized that these electrolyte imbalances were not just minor inconveniences but the root cause of his systemic muscle loss. He reasoned that the weakening of muscles wasn't confined to his legs, it was affecting the smooth muscles supporting his pelvic floor, leading to the rectal prolapse and inguinal hernia. The frequent urination could be linked to altered kidney function due to electrolyte shifts, and the heart skipping beats, known as palpitations or arrhythmias, is a well-documented consequence of electrolyte imbalances, particularly potassium and magnesium deficiencies, which are vital for proper cardiac electrical activity. Armed with this self-discovered understanding, Mr. John made a bold decision. He cautiously reduced the dosages of his bumetanide, spironolactone, and Jardiance, meticulously monitoring his symptoms. Simultaneously, he began incorporating Gatorade, a readily available sports drink, into his routine, recognizing its potential to help replenish lost electrolytes. The results, though anecdotal, were nothing short of remarkable. The unsettling, heartbeat skippies vanished. The strength returned to his legs, making daily activities easier. His trips to the bathroom became less frequent and less urgent, and difficult urination disappeared. And, astoundingly, the need for surgical intervention for his inguinal hernia and rectal prolapse diminished significantly. While still under medical care, Mr. John's proactive approach and self-directed adjustments, in consultation with his doctor, had seemingly addressed the root cause of his debilitating secondary symptoms. The systemic challenge: why doctors may miss the root. Mr. John's journey powerfully illustrates a critical flaw in modern, specialized healthcare. While each of his specialists, cardiologist, urologist, gastroenterologist, was highly competent in their respective fields, none independently connected the dots across seemingly disparate symptoms to identify the common underlying cause: medication-induced electrolyte imbalance. The silos of specialization, doctors, by necessity, become experts in specific organ systems. A cardiologist focuses on the heart, a urologist on the bladder, and a gastroenterologist on the digestive tract. This deep knowledge, while invaluable, can inadvertently create blinders that prevent a comprehensive, whole-body view. Each specialist may address their specific concern without realizing its potential interaction or shared root with other seemingly unrelated symptoms the patient is experiencing. The power of protocols, medical standards of care, are derived from population-level data and clinical trials. While crucial for ensuring quality and safety for the majority, these protocols cannot account for individual variations in drug metabolism, sensitivities, or unique physiological responses. A doctor following a standard guideline for CHF management, for instance, might focus on optimizing cardiac parameters without adequately weighing systemic side effects like muscle weakness, especially if routine electrolyte labs fall within a normal range that may still be suboptimal for that specific patient. Time and information constraints. Modern medical appointments are often brief, making it challenging for doctors to delve deeply into every nuanced symptom a patient presents, particularly those that don't fit into a clear diagnostic category for their specialty. Furthermore, fragmented electronic health records often make it difficult for one specialist to easily access and synthesize all notes from other providers. Test results may not show reality. Crucially, this is compounded by a fundamental limitation in diagnostics. Test results may not always show the full reality of a patient's physiological state. Blood tests provide a snapshot of a moment in time. For medications like bumetanide, a potent loop diuretic, its effect on flushing out electrolytes is rapid and relatively short-lived, typically peaking within a few hours and largely subsiding within 6 to 12 hours. If a patient takes their medication in the morning and their blood test is drawn later in the day or the next morning, after the drug's peak action has passed, the body's natural compensatory mechanisms may have already begun to restore electrolyte levels in the bloodstream. The test result could then appear within normal limits, even if the patient experienced a significant, symptomatic dip in electrolytes just hours prior. Furthermore, while blood tests measure serum electrolyte levels, those circulating outside the cells, crucial electrolytes like potassium and magnesium are primarily located inside the cells. Chronic diuretic use can deplete these vital intracellular stores, even if the serum level temporarily normalizes for a blood draw. This inherent limitation means that a doctor, relying solely on seemingly normal lab results, might genuinely believe no electrolyte imbalance exists, inadvertently overlooking the true cause of a patient's discomfort and decline in quality of life. Real-world examples: the impact of systemic gaps. Consider these real-world examples that echo Mr. John's dilemma. Patient A, 78 years old, a patient with heart failure and reduced ejection fraction, EF, meaning her heart was pumping less blood than it should, had a resting heart rate of 40 bpm. They were on a beta blocker, a medication that slows the heart rate and relaxes blood vessels, and had a pacemaker for years, yet reported severe insomnia and debilitating fatigue. While beta blockers are vital for heart failure and a pacemaker addresses bradycardia, the profound fatigue and insomnia might be directly linked to the beta blocker's systemic effects or the critically low heart rate, even with pacing. A focus solely on cardiac parameters, EF, preventing critical bradycardia, without holistic consideration of the patient's energy levels and sleep can lead to a severely diminished quality of life, effectively trading one set of symptoms for another. Patient B, 79 years old, an elderly patient presented with fecal impaction, a serious and painful condition. Simultaneously, they were prescribed amlodipine for hypertension. Amlodipine, a calcium channel blocker, a type of blood pressure medication that relaxes muscles, including those in the gut, is well known to cause constipation as a common side effect by relaxing smooth muscles, including those in the gut. Prescribing a medication known to induce constipation to a patient already suffering from fecal impaction is a stark example of a lack of integrated clinical thinking, where the treatment for one condition directly exacerbates another existing problem. In both these scenarios, and in Mr. John's case, the patient was experiencing symptoms across multiple areas of specialty: cardiac, gastrointestinal, muscular, neurological, urological, where a holistic solution seemed unlikely to emerge from the standard, fragmented approach. The doctor's expertise, while profound in their specialty, might not extend to the comprehensive, interconnected understanding required to unravel the root of such widespread issues. The science of balance, electrolytes and systemic health, reiterated. Building on Mr. John's insights, it's clear how critical the delicate balance of electrolytes is for overall physiological function, especially in CHF patients. These electrically charged minerals, including sodium, potassium, magnesium, calcium, and chloride, are vital for nerve and muscle function, fluid balance, and countless metabolic processes. In CHF patients, the delicate balance of these electrolytes is often challenged by the disease itself and the medications used for its management. Diuretics, a cornerstone of CHF treatment to manage fluid overload, can lead to significant electrolyte losses through increased urination. SGLT2 inhibitors like Jardiance also have a diuretic effect and can impact electrolyte levels. Bumetanide, a powerful loop diuretic, is particularly effective at removing fluid but is also notorious for flushing out essential electrolytes like potassium and magnesium, which are crucial for every muscle in the body. The consequences of electrolyte imbalances can be far-reaching. Muscle weakness. Deficiencies in potassium and magnesium are directly linked to muscle weakness and fatigue, explaining Mr. John's debilitating leg weakness and potential impact on smooth muscles. Cardiac arrhythmias. Imbalances in potassium, magnesium, and calcium can disrupt the heart's electrical system, leading to palpitations, skipped beats, and potentially more dangerous arrhythmias. Smooth muscle dysfunction. The smooth muscles lining the digestive tract and supporting the pelvic floor are also susceptible to the effects of electrolyte imbalances, potentially contributing to conditions like rectal prolapse and inguinal hernias due to weakened supporting tissues. Kidney function. Electrolytes play a crucial role in regulating kidney function and fluid balance. Imbalances can exacerbate kidney issues and contribute to changes in urination frequency. Mr. John's use of Gatorade, while not a perfect electrolyte replacement solution, likely provided some replenishment of sodium and a lesser but still beneficial amount of potassium, potentially contributing to the improvement in his symptoms. However, it's crucial to note that self-treating with over-the-counter sports drinks without medical guidance can be risky, as they may not provide the full spectrum of needed electrolytes in the correct proportions. Patient-led oversight. Why it's critical for survival in complex chronic conditions. The detailed accounts of Mr. John, patient A, and patient B vividly underscore that the stakes in managing complex chronic conditions like CHF are incredibly high. These aren't just cases of discomfort or diminished quality of life, they reveal scenarios where systemic gaps can lead to potentially life-threatening oversights. It's in this stark reality that patient-led oversight transcends being merely indispensable, it becomes unequivocally critical for survival and true well-being. This isn't merely about patient advocacy, it's about addressing the inherent limitations of a fragmented medical system. As seen in the cases discussed, even well-intentioned, guideline-driven care can overlook the intricate, dynamic interplay of symptoms and medication effects on an individual. Patients, as the constant observers of their own bodies, are uniquely positioned to connect disparate dots, especially when routine diagnostics provide only static snapshots. For the elderly, often managing complex multimorbidity, having multiple chronic conditions, and polypharmacy, taking multiple medications simultaneously, their active role becomes even more paramount in safeguarding their holistic health against the risks of oversight and suboptimal treatment. If not closely watched and well managed, the systemic impacts of medications, such as muscle loss, can significantly contribute to the high mortality and diminished quality of life often seen in CHF patients. Mr. John's journey powerfully illustrates the need for a truly comprehensive and patient-centered approach to managing CHF, where the patient is an active, vital participant. For patients, your indispensable role. Be your own chief medical officer. You are the constant in your healthcare journey, overseeing all specialists and symptoms. Educate yourself relentlessly, understand your conditions, the mechanisms of your medications, and their potential side effects, including their impact on electrolyte levels. Understand that a single, normal, lab result might not tell the whole story, especially if your symptoms suggest otherwise. Record everything. Keep a detailed log of all your symptoms, even seemingly unrelated ones, their severity, when they occur, and how they respond to changes. This includes noting if symptoms appear strongest at specific times relative to your medication doses. This provides invaluable data that a doctor cannot gather in a brief visit, particularly for issues that diagnostic tests might miss due to their transient nature. Ask incisive questions, don't hesitate to question. Could this new symptom be related to my medication? Could my various symptoms be connected by an underlying cause? What are the potential systemic effects of this drug? When were my electrolyte levels last checked, and can we recheck them, perhaps considering the timing of my medication? Could my symptoms indicate an issue even if my blood test results appear normal? Demand holistic guidance. Collaboratively discuss all your symptoms, even those that seem unrelated to your heart condition, with your doctor. Emphasize the timing of your symptoms relative to your medication. If one specialist dismisses a symptom as outside their scope or attributes it solely to normal aging or normal test results, despite your ongoing suffering, ask them to note it in your chart and explicitly ask your primary care physician to help you connect the dots or refer you to someone who can provide a more comprehensive assessment. While Mr. John's success involved cautiously adjusting his medications, it's vital to emphasize this wasn't done casually or arbitrarily. His actions were grounded in extensive personal research, meticulous daily symptom tracking, and a clear understanding of how each drug functioned for his body. This kind of informed, incremental experimentation is very different from arbitrary self-medication. In chronic conditions like CHF, where appointments can be months apart and standard lab results may miss time-sensitive physiological dynamics, patients must sometimes engage in real-time responsiveness to their symptoms. Ideally, such actions should be made with prior input from a doctor, perhaps with pre-agreed flexibility for dosage adjustments based on specific symptom patterns. At minimum, all changes should be thoroughly documented and reviewed with the prescribing physician as soon as possible. This approach is not intended to replace medical guidance, but to responsibly bridge the dangerous gap between real-time symptom burden and delays in care inherent in the medical system. Do not adjust medications without consultation. While Mr. John's initial actions were bold, it's paramount to reiterate: never adjust your medication dosages or stop prescribed medications without explicit consultation and approval from your doctor. Your self-education should empower you to discuss and propose changes, not to unilaterally implement them. For doctors, practice systemic awareness. Be mindful of the potential for CHF medications to cause electrolyte imbalances and their wide-ranging systemic consequences that may manifest far from the heart. Understand the pharmacokinetics of these drugs, how they move through and affect the body over time, and how that impacts the reliability of a single, static blood test in capturing dynamic electrolyte shifts. Proactive electrolyte monitoring and interpretation. Implement routine and comprehensive electrolyte monitoring in CHF patients, especially those on diuretics and SGLT2 inhibitors. Critically, interpret lab results not in isolation, but in the context of the patient's full symptom picture, including the timing of symptoms relative to medication doses. Consider that normal ranges may not be optimal for every patient, and that transient depletions may not be caught by routine draws. Educate patients thoroughly, clearly explain the potential side effects of medications, the importance of reporting seemingly unrelated symptoms, and empower patients to be active partners in their care. Embrace patient insights, recognize that patients are living with their conditions 24/7. Their subjective experience and observations are invaluable data points that complement objective test results, especially when those tests might not fully reflect dynamic physiological changes. Facilitate holistic strategies. Consider incorporating strategies to support electrolyte balance, such as dietary recommendations or targeted supplementation, as part of the overall management plan. Individualized treatment. Recognize that each patient's response to medications and their susceptibility to side effects can vary. Tailor treatment plans accordingly and foster a collaborative environment. Improve interspecialty communication. Actively seek information from other specialists treating the same patient and consider how various treatments might interact or contribute to a broader symptom picture. Summary and final thoughts. Rethinking the patient's role in chronic care. Mr. John's journey, and those of similar patients, reveals an uncomfortable but vital truth: even well-intentioned, guideline-driven care can fall short when it fails to account for the unique and dynamic interplay of systems within a patient's body. When life-altering symptoms like muscle loss, arrhythmias, or organ dysfunction arise not from the illness itself, but as unintended consequences of treatment, it is often the patient who holds the clearest, real-time perspective. Their lived experience becomes indispensable data. This is not an argument against medical protocols or expertise. Rather, it's a call to reframe the patient's role, from passive recipient to active investigator, communicator, and collaborator. Especially in conditions like CHF, where polypharmacy and fragmented specialty care increase the risk of oversight, patients must often be the ones to connect the dots. Key takeaways. Trust your pattern recognition. When symptoms feel interconnected, they often are. Electrolyte depletion from standard CHF medications can silently undermine muscles, organs, and overall system function. Normal labs may not reflect dynamic, intracellular, or time-sensitive deficiencies, especially in patients on fast-acting medications. Holistic synthesis across specialties is rare. Patients must advocate for integrative thinking. Never adjust medications alone, but bring symptom data and timing to guide shared decisions with your care team. Ultimately, patient survival and quality of life in chronic illness may depend as much on informed self-advocacy as on any prescription. Medicine may guide the body, but only the patient can feel it from the inside out.